Oral hypoglycemic agents are basically medications to help lower the blood sugar level. So these are used mainly for diabetes. What you have to remember when it comes to the oral hypoglycemic agents is that the patient needs to have function of their pancreas, so it cannot be completely shut down. The first class of medications that we're going to talk about is sulfonylureas. Sulfonylureas, their mechanism of action is by binding to receptors on the pancreas, which then stimulates the insulin secretions. Next is the therapeutic effects: increase in pancreatic insulin secretion, therefore glucose control. Indications: diabetes type 2. Precautions and contraindications: definitely sulfa allergy. So if a patient is allergic to sulfa, we need to verify the order with the physician, and we need to make sure that it's okay with the physician, and maybe consult if it's not okay, then what is an alternative to give, right? Especially if the patient truly has sulfa allergies. Side effects include hypoglycemia, nausea, heartburn, agranulocytosis, and thrombocytopenia. Agranulocytosis is dangerously low WBC, so specifically neutrophils. Thrombocytopenia, on the other hand, is low platelet levels. So back in the day, there used to be first generation and second generation sulfonylureas. So just so you know, we don't use the first generation sulfonylureas anymore. Now what we currently use are the second generation. So the drugs that you have to remember for this class is glyburide and glipizide. Glyburide and glipizide. The next oral anti-diabetic agents that you guys have to remember are the biguanides or bigonide. So biguanides work by decreasing insulin resistance, therefore increasing insulin sensitivity, decreasing gluconeogenesis. Gluconeogenesis means the generation of new glucose or new glucose production. Another mechanism of action is decreasing the intestinal absorption of glucose. So again, the mechanism of action of biguanides includes increase in insulin sensitivity, decrease in insulin resistance, decrease in gluconeogenesis, and decrease in intestinal absorption of glucose. Therapeutic effects include glucose control, and you have to remember that unlike the other medication, this does not affect the amount of insulin produced. It doesn't have anything to do with insulin production. Indications include diabetes type 2, metabolic syndrome, and PCOS or polycystic ovary syndrome or polycystic ovarian syndrome. Metabolic syndrome is basically a cluster of conditions wherein there's an increased blood pressure, blood sugar, there's an excess amount of body fat on the waist area, and usually they have abnormal cholesterol or triglyceride levels. So most of the time, they happen at the same time, and patients experiencing this are at a higher risk for developing heart disease, stroke, and diabetes. Polycystic ovarian syndrome or polycystic ovary syndrome is basically a hormonal disorder which causes enlarged or ovaries that have multiple cysts, and so this is associated with insulin resistance. So signs and symptoms includes menstrual periods that are irregular or sometimes no menstrual period at all. They may have excess body and facial hair. They may have a lot of acne. So this medication is used for not only for diabetes but also for metabolic syndrome and polycystic ovary syndrome. Precautions and contraindications. So we need to stop this drug in the following cases. So it needs to be stopped when a patient will undergo anesthesia or they will receive IV dye contrast. It needs to be stopped 48 hours before, 48 hours after. So it's before and after they receive anesthesia or IV dye. So some conditions wherein this medication is contraindicated include tissue hypoxia or low oxygen level, lactic acidosis, and dehydration. So why is that? Well, contraindication is renal dysfunction with creatinine greater than or equal to 1.5. And so if you recall the previous precaution or contraindication, right, the IV contrast dye and anesthesia, those medications can be toxic to the kidneys. So administering this medication actually affect the kidneys as well. So altogether, it can worsen kidney function. So that's why we need to avoid that. So we need to check our kidney functions and make sure that the creatinine is not greater than 1.5. Another instance when we may have to hold the medication, right, because it's contraindicated, is when a patient is in acidotic states. So if their ABGs, when you draw their ABGs or arterial blood gases and it shows that their pH is low, which means their blood is acidic, then we may want to hold this medication. Some other contraindications include liver dysfunction, liver disease, heart failure, and sepsis. Side effects that we have to remember, this may be the most common reason why patients will refuse this medication, is multiple GI symptoms. This medication actually causes a lot of abdominal discomfort, sometimes causes flatulence or diarrhea. So mainly the diarrhea is what most of my patients would complain about, and sometimes that may be the reason why they don't want to take it anymore. And so if they stop taking it, then we're not achieving our goals of controlling their blood sugar. So sometimes we just need to educate them about it. Sometimes there needs to be an adjustment of the dose, or sometimes a different formulation. So they also have the extended release version of this medication, so maybe that's something that they need to be on instead of the regular version of the medication. Because of all the diarrhea and GI effects of this medication, it can decrease the absorption of vitamin B12 and folic acid. Therefore, it can lead to malnutrition. Another thing that can happen in with this medication is lactic acidosis, and that is why any state of acidosis is contraindicated, because this medication alone can cause lactic acidosis. The drug that you have to remember is glucophage or metformin. Glucose elevating agents, so these are medications that will increase glucose levels. So these are given in events of hypoglycemia. So what is hypoglycemia? Hypoglycemia is basically low blood glucose. So generally speaking, when the blood sugar is below 70 milligrams per deciliters. Some signs and symptoms of hypoglycemia. So think about it when you skip the meal and you haven't eaten all day, and let's say it's already at 9 p.m., right? How would you feel? So most of the time you may feel shaky, irritable, right? So it's very similar with patients who experience hypoglycemia who are diabetic, but sometimes their symptoms can be worse. So some symptoms of hypoglycemia include confusion, irritability, tremor, sweating, hypothermia, and possibly seizures. Complications from hypoglycemia include coma or death. Hypoglycemia needs to be treated immediately because it's very dangerous, because it can lead to coma or death. Now, glucose. So how do we treat hypoglycemia? Well, we give them glucose. So there's different methods of administering glucose. So in the clinical setting, what you may see often is the IV or intravenous form. So that would be your D50 IV. In some areas, they may give oral, which are tablets, so glucose tablets, and sometimes some gels. This method is mostly used in the outpatient setting or in people's homes, especially if they know that they often get hypoglycemic. Some people will actually have this in their purse or somewhere at home. Glucagon can also be given. So what is glucagon? So glucagon actually stimulates glycogenolysis. So glycogenolysis is the conversion of glycogen from the liver and it becomes glucose. So conversion of glycogen to glucose. Some nursing actions, obviously we need to continue assessing our patients, right? Is the medication effective? So are we achieving the therapeutic effects? Is the patient experiencing side effects? And also, how much do they know about their medications? So their knowledge about their medications. And also patient and family education. So the disease process, what's going on, right? What's the treatment and what happens when they're sick? Is their blood sugar going to go up and down? And most of the time, their blood sugar will go up when they're sick. And also medical alerts. So sometimes, especially with patients who often experience hypoglycemia, right? Do they have a means to call for help? And do they have means of communicating to somebody that they may be hypoglycemic? So sometimes a medical alert bracelet will be helpful in case somebody finds them semi-conscious or unconscious, then it may give that person an idea of what may be going on with that patient. Now, obviously, lab-wise, we need to follow, monitor, analyze, or prioritize their glucose levels and potassium, right? Because as we recall, potassium follows glucose, and as well as their fluid volume status.